Well, today we had a beautiful, exciting, superb Claude Bernard talk by Professor Mark Cooper, which really gave a new insight into the development of chronic complications of diabetes. And in my view, the real beauty of this talk was also that he gave it in such a way that everyone could understand it. In particular, those people who are not involved in basic research, but he gave the talk in the way that everyone could get the message. And that's the most important. I mean, it's not the point that a clinician who works with real patients on everyday basis, of course, such a clinician cannot understand everything on the molecular basis and is not involved in basic research, but at least needs to have an idea what's going on, and this talk was really a perfect one. I have long not heard such a beautiful presentation. Yeah, it might be an issue, and also when coming to the congresses, when we look at the program books, we normally select between something which we call rat or mice medicine and clinical medicine, and the problem is that many times these two segments do not communicate. And in my opinion, it's a pity. Well, it's many times a matter of inspiration. Of course, I do primarily focus on the topics which are in my everyday practice, the segments I'm working on. And this is particularly the diabetic foot, but also inpatient care. So I mean by this the management of hyperglycemia on the hospital ward. But also, since I am running also the outpatient clinic regularly, I have to learn new things about all kinds of therapy. I have to follow that, and indeed I have to is not the right expression. I enjoy it because it's interesting to see how the therapy of diabetes has changed, improved, evolved since the year 1990. So in the last 25, 27, 30 years, if you like. I remember when I started, there were among the orals practically only sulfonylureas. Because metformin, we were a bit of insecure whether is it a right one or is it not. Should we think a little more on lactic acidosis? Should we be concerned? And then, of course, it entered again through the main door. But afterwards, there was, I could say, an explosion of new things, not only orals, but also non-insulin injectables. And so to keep all the information and to make a good synthesis is sometimes a challenge. Well, in the field of the diabetic foot, huge progress has been made. I may say that the real focus on the foot came in the early 90s, or maybe between the year 1980 to 1990. And the breaking point for many was the first International Diabetic Foot Symposium, which was held in Noordwijkerhout in the Netherlands. I remember, I'm proud to tell that I have attended all these diabetic foot meetings, which are held every 4 years. But on the occasion of the first meeting, there were only about 400 participants, and we were really a foot family. So everybody knew everybody, and during the conference dinner, we were all in one room. And the organizers mixed us so that you were forced to sit with people you have not met before. But it was really a cozy feeling. And then, of course, this conference has expanded, and now you come and the sessions are running in parallel. You cannot even find people you are sure that they are there. But anyway, that means that it's no more the smelly foot, but it's something interesting, something that should be treated. And also a beautiful thing is that we have realized that it's not only the foot, but that the patient with the foot problem needs to be treated as a whole, because the foot is only a manifestation of other serious illnesses which are present, but we may not be aware of them. At the beginning, we started the foot clinic in our country, in my center, in the year 1990. And in parallel with us, there were 2 more foot clinics. But at the beginning, we were not focused on research, but we were focused on establishing proper diabetic foot care service, because there was nothing existing, no podiatrists, no educated nurses. So we had to start from the beginning, and we first established the training courses for the nurses, and we introduced the screening procedure into the diabetic clinics all over the country. And then there was the idea about starting a research in the field of microcirculation in diabetes, and that's what I did for my PhD, but that was quite some time ago, 10 years ago, and then we continued with this. But my colleagues currently now are more focused on peripheral arterial disease, and as I have mentioned before, we are now working together with the Faculty of Medicine, with the Institute of Physiology, and we are studying the effects of hyperbaric oxygen on the diabetic foot. That's a difficult question. I feel that it also depends on the young fellows which are coming to the department, who have new ideas, and I will let them do it. I feel it's better that they themselves get an inspiration and then do some research. But of course, our institution, we are the university hospital, and certainly it's not only the foot. We also work on diabetic nephropathy. Also, we are very good in the field of diabetic pregnancy. these are at the moment the most significant parts. Then one field I am very interested in is also diabetic neuropathy and foot infections. So we'll see what comes out. Well, the point is, many people say, well, why do you have to go, why do you have to travel that far to listen to the talks? You could easily follow on the web or read in the papers, but it's not the same. If you sit in the room and listen to someone presenting his own data, you can ask questions. And also it's the opportunity to meet the colleagues, to make new acquaintances, maybe to find people with whom you could perform research together. And another very important aspect is, if you are at home or in your own clinic or in your own office, then you simply don't have time. You have to do the routine. The people are coming in, asking questions, interrupting you. On the other hand, when we are here, we are focused. And when you are in the lecture room, no phone, no computer, no emails, nothing. You just listen to it, and then it's easier to remember it. That's, in my view, the most important point. But also, as I have said, the breaks, the evenings, you are together with people from other countries. Well, that's a difficult question. I think that if you want to profit from such an event, you need to have at least a certain level of basic knowledge. And for students, at least in my own setting, I first suggest that they should attend the local meetings to get the feeling at first how the meeting looks like and how it functions. Because if you just come here, it's like coming to the Olympic Games. You are lost among 10,000 or more than 10,000 people, many different places. You just look around, where should I go, what should I take? No, it doesn't make sense. It certainly depends on GDP. But lower GDP does not always mean lower level of rights. And when I'm talking to people from other countries, I can see that our patients may get something which is not available in the richer countries. But the point is, the insurance companies create their politics, of course, on the basis of the money which is available. That's true, and that cannot be changed. But on the other hand, we should not forget that we are not economists, but we are physicians. And the reason why we are here is that we should learn new things. Then the decision whether these new things could be brought into reality in our own setting, that's the decision of politicians and economists. But still, if you know what is the best for your patient, if you have strong arguments, then also you might influence the politics in your own country. If you just sit and listen to them, then nothing will move. And here, on such meetings, we learn new things, we see new research, we get new data, so we have something which can support our efforts when we negotiate with the insurances. Well, as the president said this morning, EASD really is the home for all who are involved in diabetes care, and I would say also for the patients with diabetes. It's a platform where we can get what we need. And maybe one of the messages which is also important is that not everything that counts is expensive. Here we can see many things which patients can get for free. And for me, one of them, which I have been trying to implement during the last 20 years, is that physical activity and healthy lifestyle cost nothing. So you don't need just expensive drugs. You may need simple things, but it's also here where you can get the data which show that this is true.